This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Okay, so I've done it. You've probably done it. You don't feel right. You just get some weird kind of little symptom, but you don't want to go to the doctor with it, so you go to the internet. Next thing you know, you've self-diagnosed yourself with some remote disease found only in the highlands of Mozambique.
Yeah, you probably shouldn't put yourself through that. Instead, you can ask the doc. Chief Informatics Officer and Hospitalist Dr. Chris Snyder is the doctor on call for this segment, and he answers our questions that viewers send in. Thank you so much for being here this afternoon.
For having me.
Okay, so we're just going to get right to it. We're going to start off with one here. I hear people talking about dry needling as a way to ease chronic joint pain. What is it? Does it work?
So it's kind of the Western acupuncture, smaller needles, less injectables too. There's no injections, why they call it dry. So the needle size was something I was not aware of, but it is something that really I've learned recently. It does have a pretty good impact on acute pain, but it's only temporary usually. So there's other modalities, acupressure you've heard of, where pressure points are pushed on. So basically PT, physical therapist, folks who are trained in it actually utilize needles to localize a trigger point and try to trigger it to, or trick it into not realizing it hurts. Oh. So that's basically how it works. And it is a functional tool that does work, but it's usually fairly short-lived. I haven't seen it last long-term in some folks.
It's absolutely amazing how the body works.
It is.
Man, okay.
Beautiful thing.
Sometimes my son gets congested when he eats. It mostly happens when he eats at a restaurant, but it has happened at home too. He's tested negative for allergies. What could this be?
Well, eating and you produce saliva. Okay, so a lot of people don't realize, and you see this a lot in the elderly too, they actually get runny noses, watery eyes when they eat. So it's just the body's overestimate of what it needs sometimes. It can also be a sign of if you do have congestion or an obstruction in any of your tubes that drain fluid, if those back up because of it, because remember when you eat it causes salivation, it wants to soften the food so you can digest it, it's normal. And that being said, if your sinuses, everything kicks into play. It's not just the mouth and the throat and the stomach, it's the rest of the body. So everything's trying to moisten the food to break it down. And if you do have a problem with an obstruction from sinusitis, eye problems, it can cause a backup of that fluid, which can increase congestion.
How about that? All right, along those same lines, we have a question here. Sometimes my eyes start watering for no reason. They're not itchy or red, and it can last for a couple of days.
Yeah, tear ducts are common, and people don't realize your eyes are like windshield, or your eyelashes and eyebrows and your lids are like windshield wipers. So they basically wipe the tears away. There's a drainage system in the corner of your eye, and that drains into the back of your nose. If that's blocked in any case, that would be a problem, and that fluid can't go anywhere. So where's it going to go? It's going to dump overboard. And that's basically what happens when you have tear duct obstruction, which is more common. Dry eyes can also cause increased tearing, believe it or not, at certain times. So your body will overcompensate to try to prevent that.
Wow, okay. Why do I get bumps on the skin of my upper arm opposite my bicep?
Yeah, that's back here.
Yeah.
So, yeah, so, and that's common. Eczema is probably one of the more common causes of that, and you just get a scaling type syndrome, and the hair follicles get dried out. There's oils in your hair that keep the skin nice and moist and soft as you turn over hair, and the hair grows regularly and cuts off regularly. So this area out here just happens to be one of those areas that's predominant in folks who have eczema. So it could be a form of eczema, it could be a reaction to something topical, whether it's lotions, shampoos, whatever, laundry detergents. So those things are all, years ago it was much worse. Now it's gotten better technology with the laundry detergents. That's definitely improved it, but it's still a problem for some.
How about that? Okay, here's one. I try to donate blood on a regular basis, but sometimes my hemoglobin level is too low. Does that mean I have anemia, and how can I get those levels back up?
Yeah, they have a certain recommendation. I think it's under 13 that they eliminate your ability to give blood, and part of that's protective. Does that mean you have anemia? You could be borderline. Women tend to have iron deficiency anemia, which is the most common type. So sometimes iron supplements help, and that just has to do with the usual cycle women go through with having their monthly periods. So those things are a challenge, and you can lose iron. It doesn't mean you're necessarily anemic to a point where it's clinically relevant. That's something we would look for if it was much lower, like 10 or less. So that's what we're looking for. But it's more protective. They don't want to take blood where you don't have enough to compensate yourself.
Very interesting.
Veritable fount of
I
information.
know, right? Dr. Chris Snyder, Chief Informatics Officer and Hospitalist with PRMC. Thank you so much.
Thank you.